one area that is not addressed very strongly for the homeless in the continuum of care is medical care. The federally qualified health care centers or community health centers is a benefit under Medicare that was effective under the Social Security Act. Uh, FQHCs are safety net providers such as community health centers, public housing centers, outpatient health programs funded by Indian Health Service, and programs serving migrants and the homeless. FQHCs successfully increase access to care, promote quality and cost effective care, improve patient outcomes, and are uniquely positioned to spread the benefits of community based and patient centered care. FQHCs provide comprehensive services that address the major healthcare needs of the target population and ensure the availability and accessibility of essential primary and preventive health services, including, as appropriate, oral health, mental health, and substance abuse services. The federally qualified health centers should be an active member of your community's continuum of care. Accessing necessary health care is just one of the many challenges faced when you're without a home, but there are options available to make sure that you get the care that you need. First, understand that you're not alone. More than 500,000 people in the U.S. don't have access to reliable housing. Whether you're going through this for the first time or it's a situation you faced before, it can feel overwhelming to figure out where and how to get medical treatment. For many, the solution is to visit their local emergency room. Unhoused patients are 3 times more likely to visit the ER than other Americans, and the use of ERs by people experiencing homelessness rose by 80% over the last decade. There are also community health centers. Medicaid and Medicare also play a role. Your housing status should not prevent you from getting primary care. It's important to have a primary care doctor regardless of where you live so that you can get vaccines, screenings for cancer and other conditions, and disease management. And emergency rooms are not the only place that you can get care. Actually, going to a federally qualified healthcare center actually saves us all money, because when you go to the emergency room, those are bills that aren't paid, and it ends up costing the rest of us. So the FQHCs serve more than 1 million people a year. In addition to primary care and mental health treatment, these centers also provide testing for communicable diseases and vaccinations. Healthcare for the homeless gets special federal funding specifically for treating people who don't have housing. These centers are a part of a larger network of clinics that provide community health centers and migrant health centers, all of which operate in and for underserved communities. These centers provide emergency health care, treatment for chronic conditions, mental health care, and preventive care using a sliding fee scale. Those with incomes below poverty level don't have to pay anything for their care. You can get information about where to find those health centers from any organization that serves the homeless, or by using the tool on the U.S. Department of Health and Human Services site. Some communities also have mobile health centers that provide treatment for people living on the streets and in shelters. Having insurance can make it much easier to access health care. For people experiencing homelessness, Medicaid, the state-run insurance program for low-income people, is the best route for insurance. Medicaid facilities can provide services beyond those found in many community health centers. Such services typically include surgeries, skilled nursing, and some behavioral health treatments. You don't need a permanent address to get a Medicaid policy, but you will need to get insurance to a state where you live. If you move to another state, you'll need to get Medicaid from that state, although coverage from one state transfers to another for short-term visits. Community health centers can help you enroll in Medicaid if you're experiencing homelessness, or you can fill out an application online through the Health Insurance Marketplace or your state Medicaid agency. Community health clinics and public city hospitals provide primary care or preventive care for homeless people and others without insurance. There are social workers at these facilities who can help you fill out Medicaid and or Medicare applications. Now, there are some states that still haven't accepted the Medicaid expansion, and in those states, I would recommend that you have someone assist your homeless individual to apply for Social Security assistance, and those workers, the process for doing that is called SOAR, and those SOAR workers can, SOAR, and those SOAR workers can help you access Medicaid as a homeless individual with. So finding housing, many of the medical problems that affect unhoused people reflect broader issues created by homelessness. Along with higher rates of illness, people experiencing homelessness die on average 12 years earlier than Americans with adequate housing. When you don't have housing, there are often daily crises and challenges that make it much harder to manage your chronic conditions. So, for transitional housing for those people who have medical issues, the Department of Behavioral Health and Developmental Disabilities offers different levels of residency programs to facilitate the least restrictive living, promoting recovery-oriented environments, independent living, and maximizing quality of life. These programs are primarily for adult referrals who have received treatment services in a forensic program at a regional hospital who meet the criteria for outpatient civil commitment as determined by the court. Community integration homes provide first level of residential services comprising a network in Georgia of 11 residences located in Atlanta, Stone Mountain, Douglasville, Macon, Augusta, Thomasville, Columbus, and shortly Savannah. 2 of those homes are female residences located in Macon and Columbus. All residents have access to rehabilitative recovery services and have a primary clinician or case manager assigned. The residential programs focus on assessment of psychosocial functioning, including daily living and activity skills. To foster further independent living skills, DBHD, in partnership with Aspire Behavioral Health and Developmental Disability Services, Gateway Behavioral Health Services, Advantage Behavioral Health Services, and Behavioral Health Services of South Georgia, provides supporting housing apartments for adults court-ordered to outpatient treatment. The apartment communities are in Albany, Athens, Savannah, and Valdosta. The Forensic Supported Apartments program provides staff support and services to individuals with behavioral health disabilities. The goal of this program is to provide transitional housing, and these individuals navigate the challenges of fully independent community living. The one program that I'm most familiar with, and actually the only program I'm familiar with from the community I came from in Brevard County, is the North Brevard Charity Sharing Center Homeless Recovery Center. The Homeless Recovery Center is a low dependency care center for post-hospitalized homeless in Brevard County. The only program that I know that exists like this. This program allows for short-term recovery period at a reduced cost, and clients are assisted in developing a plan for self-sufficiency. The program includes temporary shelter, meals, clothing, amenities, and prescription assistance. Thank you, and hope you have a great day.